Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I have a couple of quick announcements for today before we bring on our guest for our discussion. We have our December Summit coming up, and all of the tickets are available in the QR code on the screen or in the chat. And more recently, we will have our June Symposium rapidly coming up at the end of the month. It's going to be a really great panel, and make sure you grab your tickets for that as well. And with that, I would like to formally introduce today's guest, Kimberly Monroe, who is a program manager at Duke Health. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Kimberly during the conversation, please use the Q&A feature or the chat, and I'll make sure that we get to it. With that, I would like to formally bring on Kimberly. Thanks so much for being here today.
Thanks for having me.
Well, I would love to maybe jump in and really start the conversation by learning a little bit more about you and your journey. So I think kind of the first thing we'd love to learn more about is, what really inspired you to pursue a career in public health and kind of community engagement, and a little bit more about your background that's led you to where you are right now.
Thank you. What really inspired me were summers with my grandmother, Jewel Johnson. My father was in the Air Force, so we got to travel around the world and across the United States, but really enjoyed summers with my grandmother. She lived in Gibson, North Carolina, which is in Scotland County, and in a little small home. But she and the missionaries would do a lot of work in the community, addressing different needs, and she would let me tag along. And so I would watch her as she would go and help families that were getting settled into the communities, new mothers, that had just had a baby, or she was even feeding people from her own kitchen. Her philosophy was that as long as I have a biscuit, you have a biscuit, and it's a sin to let anybody go without. And so that's what encouraged me to do this work.
Wow. I mean, you really got to see firsthand, what that kind of looks like. That is so incredible. I can't imagine how inspiring that must be to really get to live it so early on.
Yes.
So kind of curious too, as you it kind of seems like, this role of community engagement is something that you saw so much in kind of your personal life. Really kind of wanted to learn too, just kind of speaking of like the personal and the career together, how are you kind of currently balancing your professional and your personal life, especially in kind of the demanding role that you have right now as a program manager?
It's so important to set boundaries. And so in addition to my role as a program manager, I'm also a minister in a local church congregation, and then also helping to look after my 84-year-old mother. So it's always important to set boundaries and set limits. I have a wonderful support system with a group of women. We call ourselves Sisters of the Sun, because we try to shine a little light into everybody's lives, and ask for help when needed, and making sure, just taking care of ourselves, this vessel, as I often say. So I cannot pour from an empty cup. So I have to make sure that I'm taking care of myself as I'm out serving others.
Wow. That's beautiful. And I have to say, I love the name. I think it's so fun. And I wholeheartedly agree. And that seems like such a powerful, I think, reminder moving forward of just how you want to live both in your career and, personally as well. Want to kind of pivot and dive a little bit into kind of the professional side of Kimberly Monroe. With the work that you do right now, really focusing on the community, what do you find really kind of the most rewarding thing working at Duke Health?
The most rewarding is being able to help people at one of their most vulnerable points in their lives. And every day I get to see what my why is and be part of this fantastic group of people here. We are all helping someone at their most vulnerable point. And to help someone navigate through that, knowing that we're walking beside them through the whole way, is so rewarding. And even the work that we do here with special projects that go out beyond the walls of the healthcare institution, when you see the fruit of your labor, when you see the initiative that you put together that's helping people to get healthcare that they would not have normally been able to get, and they're thriving and living a full life, that is very rewarding. That's what gets me up out of the bed every single day.
That is incredible. And, so curious when you kind of think about your background and the role that you have right now, really
Mhm.
steeped in public health and community, what are some of the skills that you think are really critical for success in a role like yours?
Very important to have strong listening skills. And working with
Mhm.
community or with anyone, it's never a monologue, it's a dialogue. And so if you're trying to help someone, you need to listen to what they need so that you can help them. So definitely having those skills, strong listening skills, and empathy and patience, because sometimes navigating life and also just navigating some of the different barriers that we may encounter takes time and it takes patience.
Mhm. I really like that. And with some of the initiatives that you had, I know you mentioned some of the special projects that you work on, kind of outside the four walls, as well as kind of things within. How are you all kind of thinking about like what success looks like? How do you measure success and impact with all of the programs that you kind of run and coordinate?
Well, there's different ways. One is through the metrics that we as an institution set, and some of those are are directed by some of our regulatory groups, such as Joint Commission and CMS. And so we incorporate those into our strategic plan. And so those are the metrics that we set and the goals that we look to achieve. But also working with our community partners, we're also looking at community needs assessments and strategic plans where their goals are and where we can align and look at those metrics. And so to see. So it's not only the numbers that are important. You want to see, you know, uh, projects that say, for example, like one that I'm working on that will improve transportation for patients. So it's going to be more
Wow.
than just improving no-show rates. We're also wanting to look at health outcomes. Is their health improving also because they're able to make the appointments, because they're able to get the food that they need, because they're able to get the medications. Those are the other things as well. And then also feedback from the people that we're helping. Is this initiative working? What are we hearing about that? And how can we constantly improve? Because you have to keep the people that you're helping at the center of everything you're doing.
100%. And that actually is a great segue because really kind of curious when you kind of think about what are some of the things that you do to really stay updated, I think not only on kind of the latest trends and kind of what is, um, like just what you're kind of seeing in the public or, very
Mhm.
specific broader public health initiatives, but also how do you stay updated on what your community is looking for? Is really curious on if you have any kind of systems or practices in place to kind of constantly have a pulse on, what the needs are.
Sure. One is through, in Durham County, I'm part of the Partnership for a Healthy Durham. I actually co-chaired this coalition with about 350 people. And so there's monthly meetings, and there's also groups that are working on specific issues that have been identified by the community. So there's access to
Mm,
care, there's mental health, there's also physical activity and food and nutrition. And within those groups are meetings which also trickle down to the community level. So it's important beyond those reports. For me, I need to actually go do, see, touch. I often get a phone call where somebody will say, Miss Monroe, can you come look and see? So that means spending time with people wherever they may be. And that doesn't always happen between 9 and 5.
right.
Sometimes that means I'm at a church Bible study. I may be over at the senior center having lunch with individuals, but just going where people are so I can actually see. It's
Mhm.
important to have what I refer to as the lived experience. So right where they are. So if they're having problems or there's an issue that they want me to be aware of and assist with, I go where they are.
Wow. The fact that, it seems like there's so much trust between yourself and your team and the community.
Mhm.
I'm so curious, do you have any, strategies or kind of stories that you can share with us on, what does it take to really build that rapport and that trust with the community where they can really come to you. And you had mentioned earlier, during points of vulnerability to really share
Mhm.
with you and your team what they need. I'm so curious how, this relationship and this trust has been fostered.
Part of it is due to the fact that if people call me, I show up.
Mm-hmm.
So people will say, call Miss Monroe and she will come. And so, and it's not always just about the issues, it's the other things that we get to come together and celebrate in life. And so that's how we're building the relationship. So I may meet
Mm-hmm.
somebody at a community meeting, and then if they invite me to their church service, or they invite me to a tea or a luncheon, or I'm going to watch a young person play football, those are how
Mm-hmm.
you build those relationships. So, and they stay intact. And so it's absolutely wonderful that I've grown. I'm watching other people grow. In fact, I've got a high school graduation to go to later on this evening. But that's because of the relationship I built with the family, and it all started around maybe some housing issues way back when. But because I came to them where they were in their time of need, and I listened
Mm-hmm.
and I let them know how I can help and what I could do, that fostered trust.
Absolutely.
And that's what we have to do.
That's amazing. It's kind of like experiencing the highs and the lows, kind of everything, kind of collectively. I think that's so impactful, I would imagine.
Very.
Wow. And the community that you serve, that's definitely, one relationship that you have. But I would also imagine there's so many other institutions, departments, others that you all kind of work with to stand up, all of these amazing programs and initiatives. What does kind of collaboration look like with other departments? Do you have any kind of strategies or best practices there to kind of bring together various groups to kind of stand up these programs at scale and make things sustainable?
Bringing people together around a shared common goal or vision, finding out what they're interested in. So
Mm,
if I'm talking to an organization and they're talking about after school programming, it's just really listening to find out what are you looking for or what are you needing. And if they're wanting screening to happen, if they're wanting a health fair, or they're wanting something ongoing, I can look within Duke to see what I have, what I have at the colleagues. But the beauty is we also have some wonderful relations with North Carolina Central University
mhm.
and also UNC Chapel Hill. And there have been some wonderful things we've been able to do within the community because we pulled not only here within Duke, but also the other area institutions and also with the other nonprofits that exist within the community that can offer something. And so by coming together and just being honest about what we can and can't do in our scope, that's how we've been able to put some things, some incredible programs in place. Not just temporarily, but things that have been actually sustainable. But the beauty of it is that that the programs that I'm referencing, these were all issues that the community said was important and was really needed.
That's amazing. So it really seems to be, finding a lot of those shared values and interests, and then transparency also seems like a really, powerful way to bring people together. Wow.
Yes,
I
yes.
I definitely wanted to ask and
Mhm.
learn a little bit more about your experience with Empowered and the Wellness Ambassador Program.
Mhm.
Would love if you could share a little bit more about your experience and kind of the impact.
Oh, sure. Um, that particular program, I really enjoyed that with the American Heart Association. And what that program did was focused on the ability to look at what is going on in the community or the communities that we're serving around health and what kind of barriers are people encountering. And so if we're trying to work on
Mm,
reducing and improving health outcomes and well-being in the community and eventually eliminating some of these health disparities, especially in spaces and places where they're under-resourced, we really need to
right.
know what's going on there. And so what we learned is, or what I know I learned is that sometimes looks can be deceiving. Sometimes people are looking at a community and say, oh, but they have these resources, or they're only 5 minutes from a hospital, or 10 minutes, from an urgent care. But in working with the community, you learn that maybe some of the people had jobs where it was difficult for them to access routine care simply because of their schedules. And so that was, sitting and talking about how can we do something different? What can we
Right.
bring to the community? Education, screening activities. What kind of funding can we provide so that it can be
Mhm.
sustainable? And in some cases, for example, they've either been incorporated into a church within their health ministry, so that can continue to go. Or if a nonprofit um, decided that they wanted to take that piece on because they're based in the community.
Right. Wow. I mean, that sounds like that was a very impactful program. And, you bring up such a good point around kind of being able to see things not just from kind of what it may look like on the outside and using like markers like the geography and some of those other, demographic information that don't always paint the full picture.
Exactly.
And I think that can, really just come from getting in the community and really, talking to people to understand the, like you were saying earlier, just the lived experience.
Lived experience, yes.
That is so key. As I'm just, hearing you and learning so much more about the work that you're doing, it's a continuous reminder on how that is so, so important to really create things that are intentional and meaningful and that
Yes.
can last. So it's always a good reminder to me to kind of get that. I love it. Wanted to ask you a little bit, Kimberly. I mean,
Mhm.
there are so many incredible projects and initiatives that you all are standing up, and I could only imagine, with things that can get a little bit more complex in terms of the initiatives,
Mhm.
conflicts and disagreements and things like that can kind of happen. Really, really interested to know if you have any, tips, tricks, strategies. How do you handle, conflicts or things that can kind of happen between departments, organizations, et cetera, as you kind of work collaboratively to stand up projects?
Sure. Ah, yes, conflicts. So handling disagreements or conflicts requires a very diplomatic and solution oriented approach. Um,
Mhm.
when I'm managing a project or a team, I make sure that people realize that this is an environment. I try to create a culture where the team members feel comfortable expressing their concerns, and sometimes that's done through one-on-one check-ins, also through team meetings. But and when a conflict comes up, what I do is, and I always stress this to others, is to listen actively to try to understand each
Mm,
person's perspective. And it's important to acknowledge those differing opinions and perspectives because sometimes that leads to a natural solution. I try to find a way through a facilitated discussion to find, well, where is the midpoint, and where are there areas of compromise or shared goals, or finding an alternative solution that will address everyone's concern. And then just keep whatever we're doing. I
mm,
always say we have to keep the people that we're trying to help at the center of it. And that's how I try to resolve
wow,
conflicts.
that's amazing. And I like that I think there's so many like great tips and tricks from kind of bringing in others to really having those like diplomatic conversations.
Yes,
I think that's all really, important to kind of still maintain and foster a good working relationship when those things, inevitably can sometimes happen.
that it happens, but it's so important that those conflicts, you address them quickly, address them promptly, because you don't
Yeah.
want it to escalate. And then, because if it does escalate, then that pulls us away from the ultimate goal of what we're trying to do. So we have to address those.
Very, very true. I think in professional and just in life, I
Just in life,
wholeheartedly
that's true.
good strategies
Agree.
in general. Um, I also wanted to ask, I mean, for those that are maybe listening on the call right now that are really kind of looking um, to, work and have a professional career in the community health space, do you have any kind of words of wisdom or advice to kind of those people that are looking to enter the space?
Oh, making sure that they have an empathetic attitude, a compassion for people, have a big heart and being willing to listen, really listen. Um, and the lived experience,
Mhm.
the experiences that you have every single day in your life, you can bring that to the table
Absolutely.
and pursue
That's very, very, I
opportunities.
like that.
Yes, and pursue opportunities to do work in the community. I always say not just in, because anybody can work in, but work with the community. So you can really see all that's involved in the time and the things that you're going to encounter. You're going to encounter some challenges. It could be about space, time, culture, language, but you get to see the whole picture. And so find ways that you can work with your community. There's so many different ways. Volunteering. I started volunteering, as I said, spending time with my grandmother, who was a missionary working in the community. There was work that I did through scouting. And there were, and actually, God bless them, both of my parents, because they kind of had that immediate opportunity, had that same vision of, always helping your fellow man.
Absolutely. I love that. And I wholeheartedly agree of there's so we're kind of lucky that there's so many great ways to kind of immerse yourself in those opportunities.
Mhm.
Whether that's like you were mentioning, volunteering, nonprofit, there's a lot of, I think, really, really great work to be done to just even take that first step to kind of get involved.
Right.
That's amazing.
Mhm.
Um, and now I'm kind of curious as you kind of think about, you have such a wealth of knowledge and so much experience in what you do. And I would imagine that, education, professional development, and all just kind of continues to fuel that engine.
Mhm.
I think my first question is, I know you have kind of an educational background in health and human services,
Mhm.
and, business and finance and all of these things. How has kind of your education, and your background really contributed or served kind of where you are right now? Are there kind of any lessons or things that you have been able to pull from your just your past experiences?
From my schooling experiences, I think the ones that I benefited the most from were the ones where there was some type of practical curriculum where you got to go and do some work either with an agency. For example, in undergrad with the business degree, I was working with students in free enterprise. And so we actually had to work together with other area businesses to put together a bag for students to utilize during their last couple of weeks of school when they're trying to,
Oh,
and it had, um, snacks for them to eat and everything. And so it was a good lesson in working with diverse groups of people
wow.
um, all around a common goal. And that was very, very, very rewarding in that. And also in grad school at UNC, we had to do that practical curriculum our second year. And my internship was in a health department in a rural area in North Carolina. And
Wow.
that, what it opened my eyes to was at that time, was just how difficult it is for people to access care. Sometimes it's very easy to get comfortable and assume that, well, I can get to a hospital and it's no problem. But spending a year in a rural county where they could not keep obstetricians in the area and they didn't have enough money in a small hospital to have a wing for deliveries to happen, and to look at how people had to drive 30 and 45 minutes. That was so eye-opening and really made me think a lot about how we really have to look at and listen to the needs of the community when we're
Mhm.
designing initiatives and how we plan, when we're putting hospitals in place, when we're putting schools in place. There's so many factors that have to be considered. And so that's why everyone's voice is valuable.
Wow. I can only imagine really being in that position where you're just seeing, with your own eyes exactly what some of those barriers are and kind of what people's day to day looks like as they're, caring for their health or for their loved ones. I can only imagine how, like, I'm just trying to picture it, and that sounds crazy to me. So I can't imagine for you where you were actually able to see it with your own eyes.
You was able to see that. And so I remember going out, for example, with home health nurses and, in driving out in trucks and out to farms and things to really see what people were encountering. How long does it take somebody to get medicine from a pharmacy? If you live out here on your farm, how long does it take you to get to town? It was absolutely amazing to see that firsthand, the challenges that people were handling. And that's that lived experience that informs the work that you do. And it's informed the work that I continue to do every single day.
That's incredible. And I'm so curious. I mean, we were talking, before we went live around the opportunity with IT and with technology when it comes
Yes.
to maybe those barriers that you saw with your own eyes. And I'm so curious, is there anything that you see as, wow, IT and tech can really, really help with some of these barriers, whether it's, I don't know, telehealth or improving access. Is there anything that you've kind of seen as really like an amazing opportunity for IT and tech?
Yes. Just recently, I have a sister who's a nurse and a minister, who lives in Scotland County, North Carolina. And she does some work in some rural areas around there. And she is doing work around telehealth. And I've had an opportunity to see that where people can come to her office if they can't drive an hour or an hour and a half to get to a physician. They can drive maybe 15 or 20 minutes to her office where there's a computer set up where they can log in just like we're logged in here and have a whole conversation and have a visit. And
Wow.
I just thought that was absolutely amazing. And so that's just the start of some work that's been done there. And I thought there's some incredible things that can be done with IT. What else could be done if some of the barriers in terms of accessing Wi-Fi, what if that can be addressed? And we're working on that in North Carolina. But looking at how community health workers can go out in the field with an iPad and get information to help people and it all be immediately recorded. Or churches setting up, which is something my sister's getting ready to do. They have Wi-Fi, so they're going to have some education sessions around women's health issues where they can actually zoom in people to do that in a space, in a place that's comfortable and familiar to them. So it is just very eye-opening. And I've been talking with some of my colleagues here at Duke and other places about there's just such tremendous opportunities for us to tap into IT and really work with people and help people and to see even my own 84-year-old mother interact with a primary care physician on an iPad was absolutely wonderful. And I thought, okay, this is great. This is just the beginning.
100%. And I love how you're really describing the idea of how tech can really bring people and bring care to where they are right now in places and settings that are comfortable and familiar to them. And it's amazing. Yeah, you definitely are painting, such a bright future when we think about how technology really can, do so much good in the community. And I also just realized that it is 10. How crazy. 30 minutes just went by like that. It was.
It did. I so enjoyed this.
Me too, Kimberly. I feel like, I mean, I have so many additional questions for you. We'll definitely need to bring you back on for a part two.
Part two.
But I
Okay.
really appreciate it. Yes,
Sure.
let's do it. But thank you
Okay,
so much for taking the time. Yes.
Thank you.